guided by the science. That's what we've been told, as if science is an omnipotent divine intervention, inalienable, immutable and absolute. The science. Well, except there's no such thing as the science, only science. And all too often, it does not agree. One nerd's indisputable hypothesis is another boffin's bunkum and balderdash. So when the government talks of a singular science, it's only right, surely, we question what and whose. For most of us, the modelling informing Chris Whitty's jolly through his televised slideshow is mind-boggling, to say the least. But with rumours of rifts at Cabinet over whether the number crunching is way too pessimistic, and a slip of the Twitter tongue by the head of modelling at Sage, suggesting perhaps that their maths must match policy rather than the other way around, surely it's time we tried to wrap our skulls around the formulae dictating our lives. Oh yes, folks, it's GBNews maths lessons, because we really need to talk about the science. Next slide, please. Well, friend of the show and numerical boffin, Jamie Jenkins, who's an independent statistician and political commentator, joins me now. Jamie, should we trust the modelling? Should we trust the science and be taking decisions from that? Or should we be far keener to look into what's going into those calculations and perhaps be a little bit wary of basing too many decisions on it?
Yeah, Alex, I think that obviously you need to have some plan for some scenario. It's the same with the weather. You know, you've got weather models that the Met Office will run to kind of look at what's happening at the moment, what's happened recently, to kind of tell us what's going to be happening on Christmas Day. Are we going to get any snow for Christmas Day? And it's a similar thing, really, with when you're trying to predict pandemics, because you've kind of got what data is happening at the moment, what have we learned from the past, what can we predict in the future. But I think the difficulty we've had with the SAGE modelling and Professor Neil Ferguson themselves is that many times the models that they've been coming up with and the numbers they've been coming up with, when you then, because the good thing with coming up with scenarios, you get to mark the homework in a way. And think back to September, we were told by SAGE if England didn't bring in Plan B restrictions, we would get potentially up to 7,000 hospitalisations a day in England. Obviously, Boris didn't bring in Plan B restrictions. Now, the 7,000 was the upper limit, but they said 2,000 to 7,000. So that was the range that they came up with. What actually happened? It was closer to 700, 1/10 of the worst case scenario. So Boris didn't follow the SAGE advice then, and we didn't end up with a catastrophic outcome than what SAGE was saying. So we've had this constantly in the past now where Neil Ferguson originally was predicting 500,000 deaths. He's been predicting 5,000 Omicron deaths have been talked about. And I think it was on the Breakfast Show a couple of days ago talking about the kind of how nonsense those facts and figures were as well. So it's difficult to, it's like the boy who cried wolf. There could be a time where SAGE comes up with the bang on kind of metric of what we want. But when they're so wrong all of the time, can you trust it?
I suppose you can't blame a government for being risk-averse, though, because the same Neil Ferguson said that he believes now, latterly, retrospectively, if the government had locked down a week earlier, at the very start of this pandemic, so back when the borders were shutting and continental Europe was largely locking down, that he thinks that there would have been half the deaths that we finally saw. I mean, that's a big change based upon a delay of just 7 days. Do you think with Boris Johnson announcing just then at 5 o'clock that Christmas isn't cancelled, we can all go ahead with our plans as normal, that this is a political decision that could end up having terrible consequences? Are you quite comfortable that rather than constantly go towards the worst case scenario, that the government are finally learning to balance this out with societal needs and economic needs?
Well, on the front of the Daily Mail last 27th of December, we were told 15 million jabs to freedom. Now we're currently, Alex, on 128 million jabs now. So, 8.5 times as many vaccinations have been dished out. Now, what Boris and the other First Ministers across the UK are banking on is the booster rollout to kind of get extra antibodies in the population. Not a bad thing, I suppose, there. And they've sped up the actual booster rollout. But if you look now at this time last year, and people who are going into hospital, 70% of all the hospital admissions with COVID were 65 and over in terms of age. And we know this is a virus that attacks the elderly. Now, let's look at the actual statistics today. 87% of people who are 65 and over in England have had a booster jab, and it's even up to like in the high 90s when you look at 75 to 79-year-olds. So the most vulnerable people have already had a booster. Now, if the government's banking everything on the booster, and the evidence coming out of South Africa and Denmark is this is a much less kind of deadly virus, then there is no real evidence to kind of go into a lockdown, because where are all these hospitalizations going to come from that Sage are talking about if the majority of people who may be the ones who end up in hospital have already had the booster? You're not going to see 18, 19, 20-year-olds rocking up in ICU without having a booster, only with 2 jabs, probably not even vaccinated, because that's the way the virus works. So I think Boris has probably made the right decision at this point. What we see after Christmas, there's obviously a split in cabinet, and we'll see what he comes up with in the next few days, I suppose.
Do you think Sage have been transparent enough with publishing not only their findings, and we often have Chris Whitty standing there in front of the big screen saying, next slide, please, and showing us a whole load of impenetrable graphs and spreadsheets. And we go along and we nod and we say, yes, he's a boffin. He knows more than we do. He's showing us bits and bobs and graphicating worst case scenarios. So obviously we trust this. But what we're not seeing are the discussions going on between the policy unit and the modellers to determine quite what they're modelling and how. How significant is that? And do you think the Sage has been transparent enough?
Well, they've released the minutes, I think, of the meetings, and they are more transparent than they are in Wales, in terms of what goes on with the modellers. I've never really looked at Scotland. I think the difficulty you have, I think in part is driven by kind of a lot of the media channels. GBNews actually hasn't been driving a lot of this, but a few weeks ago the BBC were all over South Africa and this Omicron variant. Cases in South Africa have come down in the last 3 days, and we haven't seen this rocket jump up in kind of deaths that may have occurred in previous waves. You put a BBC News on, I watched it last night, not a mention of South Africa. Similar when we had the India variant many, many months ago, we didn't see it. And the public, my mum was phoning me last week because I was taking my dad to Newbury races, say, should you take him because of the Omicron variant? So, well, I'm looking at the stats. I think there's a relatively low risk to go into Newbury races. The vast majority of the public are scared because of a lot of what the media report. And the media have a part to play in this, Alex, because they will normally pick up the Sage worst case scenarios. And in fairness to Sage, they do put a range in. But what gets reported by a lot of the newspapers is the worst case scenario, in particular The Guardian, who are pretty bad at doing this. And then people read that. And the problem then is, because a lot of people don't understand kind of ranges and statistical uncertainties, they see the worst case scenario and they think that's the actual scenario that's going to happen. So I think, in part, Sage could look at the probability of some of these things they're doing, but the media themselves are a part to play as well.
Jamie, wise words there, and thank you for coming on the most sensible, common sense, open and honest TV news channel of them all. We love having you on. Jamie Jenkins, independent statistician and political commentator, blowing some smoke up the proverbial backside of this wonderful TV station. I'm now joined by David Paton, a professor of industrial economics at the University of Nottingham. David, do you think decisions are made based on the health or the economy? And do you think Sage are going about things the right way by mapping out worst case scenarios and the impact on the NHS?
Well, right from the start, one of my worries about how policy has been enacted is that there seems to be an almost exclusive focus on infections and potential benefits of lockdowns and restrictions without really considering the costs. And it was interesting, the admission earlier on this week from the chair of Sage that they have no recommendation from the government to model the costs of the restrictions. And it's a huge gap because it's not either or, it's looking at both. And of course, we care about health and well-being, but lockdowns and restrictions also affect health and well-being as well as the economy. So you do need a balance there. And that's one of the problems, I think, with the modelling that government bases its decisions on. They don't consider the costs and the effect on the economy. But I think the other side of it is also we don't see a real analysis of whether the restrictions they propose actually have the benefits they think. Government seems to think, and indeed their scientific advisors seem to suggest, well, when you impose restrictions, a 10 p.m. curfew, or you have a rule of 6, that automatically reduces infections. When you look at the real evidence and not the modelling, the real data around the world, many of these restrictions seem to have very little impact, sometimes no impact at all on restrictions. So we have both problems. We don't have a sufficient evidence base on the costs of these restrictions, and we have an overestimate of how effective they're likely to be. And the tragedy for me is that we don't seem to have lessons being learned. So still, SAGE, the latest models, don't put any real-world data into affecting how much restrictions will lead to reductions in infections. They just assume that the restrictions will reduce infections and reduce deaths without looking at the real-world data.
Well, why on earth are they not using real-world data? If this was the world of finance, if these were bankers who were modelling potential outcomes for a business takeover and got it wrong or weren't using real-world data and weren't going back to correct their findings and feed in new inputs into their systems and models, they'd be fired. They wouldn't be doing their job properly. And when it comes to locking people down, I can't wrap my head around why any government out there wouldn't want the most accurate modelling to be done. Why do you think SAGE are not doing this?
Well, it is a little bit baffling. So one of my bugbears is that they don't model the effect of voluntary restrictions. And we've seen time and time again, as infection rates go up, people respond automatically. They limit their activities. And we're seeing this at the moment. The government have put out lots of advice and, to some extent, scary statistics about what's going on. But people have responded, and we've seen it, it does cost pubs, that we've had cancellations and so on. But the SAGE models don't take that into account. They're very explicit. They say we don't model behavioural change that will happen automatically. And that's not just a sort of, a flaw. It's a really fundamental flaw. Now, it is baffling to me why that hasn't been changed over time. You could perhaps understand it right at the start. But as your previous guest has said, some of the predictions we can judge against the outcomes. So the fact that they were predicting perhaps between 2,000 and 6,000 hospital admissions earlier in the autumn, and we didn't come close to even 1,000 admissions, should at least make them think twice and think, well, should we be looking at things a different way? But in the end, of course, it's ministers who take decisions. And it was interesting seeing the reports from Cabinet yesterday that at long last, I think somewhat too late, there were some tougher questions being asked within Cabinet about the modelling they were being presented with. And I think one of the reasons that's happening is that we can actually see the real data. So we've had these really scary stories about what's going to happen with Omicron. And, even the best case scenarios from that the government have been presented with is suggesting, well, we'll have 3,000 hospital admissions every day if we don't have big new restrictions. Well, at the moment, we're on about 800 admissions a day. And that number is lower than, back in early November. They've actually been decreasing. Now, of course, you can't be 100% certain what will happen, but government haven't even been presented with a scenario where, admissions don't rise to 3 times what they are, or more than 3 times what they are at the moment. That's said to be the best case scenario. Yet we've already seen in South Africa, infections are decreasing quite rapidly now, much quicker than what it was expected. Now, South Africa is a different country to us. It has different demographics and so on. But even in this country, in London, which is most affected, the rate of increase of cases has started to come down over the past few days. So it's really becoming quite clear we're not going to be in the situation that the modelers were expecting. Yes, I think hospital admissions will go up a little bit more because cases are going up now in the older age groups. But of course, they're not the ones who are going to be helped if you shut down nightclubs. That's not going to sort of help infections amongst the over 80s, given that infection rates amongst the younger groups, the rate of increase now seems to be coming down. And hopefully by the time we get to after Christmas, when they're talking about imposing new restrictions, it may even be that those case rates will have peaked already by that point.